Hello and welcome to my surgery diary where I am about to have a breast reduction surgery. Please understand that my case is very rare. Most people will not have 5 breast surgeries in a lifetime, let alone within 30 years. This is not something that I hope you will find alarming, but more informative to give you help and advice if you are considering having surgery yourself. To give you a bit of history about my journey with breast augmentation surgeries, this will be my 5th surgery to do with breasts. I had my first breast surgery at the age of 18 as my breast failed to develop properly. There were 2 different sizes, 2 different heights, and the nipples pointed in different directions. This made wearing bras, sportswear, swimwear really difficult, really impossible, and I went to my doctor to ask how I could correct this problem. I was suggested to go on a hormonal contraception pill, which would hopefully stimulate breast tissue growth. This wasn't the case for me, even though I did take the pill religiously, not as a contraceptive, but for breast tissue stimulation. It was worth a shot as a non-medical option. I was then told that if I pierced my nipple on the smallest breast, that this could encourage blood flow and circulation, and in turn could cause that breast to grow at a bit bigger rate than the other one to hopefully catch up with the deficit, but this wouldn't correct the height or the direction of the breasts. This again had no effect, and by the age of 18, I saved up to have a private breast augmentation surgery in Harley Street in London. At the time, PIP breast implants were the ultimate market leader. They were new, they were innovative, they were safe, the best that you could have. It actually turned out that these implants were not made from medical grade silicone, but industrial silicone, because once they had been verified as safe for use in patients, the ingredients were then switched to something that was far cheaper and easier to get hold of, thus maximising profit at the cost of women's lives. This is still to date the world's biggest medical negligence case. 400,000 women are affected by this, and it's currently in the French Supreme Court for ruling. Because of this, my chest collapsed at the age of 25 after I had my second child. I had silicone leaking from my chest, my lips turned blue, and my implants had ruptured. So I had free pouring silicone from my chest, which was entirely unexpected. After my son was born, these implants were taken out in emergency replacement and reconstruction, which covered 2 surgeries 6 weeks apart. This is where I had my natural breast tissue scooped away, the silicone, as much as they could get hold of, removed from my chest, new implants put in place, and then body fat had to be injected around the implant because without those implants I was concave and the implants sat away from my chest walls. So that was my 2nd and 3rd surgery at the age of 25. So after turning 30, I then had my 4th surgery because my immune system really took a hit. I couldn't explain why I was passing out, feeling sick all the time. I had hardened lymph nodes for 2 years, and actually it turned out that the breast implants that were used for my reconstruction were known to cause cancer. This hadn't developed into full-blown cancer, but the cells were there were abnormal changes, and it was attacking my body, making me very sick and very weak. My hair was falling out, I was fainting all the time, and just woke up exhausted every day, even after a full night's sleep. So these were changed, had them for 5 years almost, and each time that I have had surgery, the implants have had to go that little bit bigger. This is predominantly down to skin. As you age, the weight of the breast implants will drop slightly, so every time you go to change your implants, you normally go that little bit bigger to fill up the deficit. If you don't wish to go bigger, you can have an uplift, and this means going smaller in size, cutting away loose skin, repositioning the breasts at a higher rate normally. So why am I having a breast reduction? Well, firstly, I think when I had these breasts, going through all of the previous surgeries, for medical reasons, had I have been fine with my first implants, I never would have changed them. They were a double D, and that was a size that I was very happy with in my teens and 20s. Having to go through breast replacement and reconstruction meant that I had to go up a size each time, thus bringing me to today where my breasts are custom made. They are not an actual size. I can't walk into a shop and pick up a bra that will fit me. dresses don't really fit me very well. I have to wear stretchy clothes all of the time, and it's quite a chore to find sportswear that is supportive enough, and I avoid underwire bras because it does really dig into my chest and sometimes can cut me. What I'm looking at doing is dropping down a bra size or two perhaps, and having an uplift. This will allow me to have smaller breasts for future-proofing reasons, that as I get older I may not be going to the gym 7 days a week as I do now. Now that I'm 36, I'm really thinking of 5, 10 and 15 years down the line for breast surgery. What size will suit me at this point in my life, and how will it affect my body as I age if I'm unable to train as often, and my muscle structure and support. I want to make sure that I'm not damaging my neck and shoulders or back with the weight of excessive breasts. Also, there is a mental health aspect to this surgery for me. It's something that I don't think that women talk about half as much as they should in the media. And that's when we are young, we are told the things that are desirable. Through surgery, we are able to make that choice for ourselves, how we wish to look. Most people have surgery to take something away, to remove a bump on the nose, to maybe have liposuction to an area of the body that they are unhappy with. But I actually believe that surgery can be used in a very positive way, not because you hate yourself, not because you are not happy in the skin that you are in, but because you love yourself and want the best for yourself. Much as we would go to a hairdresser and have our hair trimmed, the dead ends to come off, some highlights, have your nails painted, treat yourself to a dress. Because you love yourself, you want to look and feel your best. Surgery is something that you can make a choice over, and it doesn't have to be permanent. Having had 4 breast surgeries in the past already, I know more than anyone that anything that you choose to have put into your body can be removed. There is the choice at any age and stage of life to change shape, to go up or down in size, to have round or teardrop breasts, to have very fake or very natural. Just because you've had one surgery doesn't mean you can't have another. Doesn't mean that you're stuck with the choices that you made in your 20s for the rest of your life. No, we all have that choice. We can all make that difference. And ultimately for me to have this very excessive bust, that when I started at the age of 18 and had a double D, it was the right size and shape for me. As I'm 5'8" tall, that's deemed fairly tall for a woman. My surgeon looked at the width of my shoulders, my waist and hips, and what would balance in proportion to my body. He told me at that time that a double D would suit me perfectly, and I was very happy with those. Had I not have had my breast collapse, would I ever have gone bigger? I'm not entirely sure, but yet here we are years later at the age of 36, and I'm about to have my 5th surgery. Also to talk about breast reductions, breast uplift, what's involved and how does that differ from having a normal breast augmentation surgery. Touching upon the mental health aspect of having a large bust, there is judgment that comes with that, and anybody considering surgery, I would say ask your surgeon what they recommend is right for you as an individual. Don't look to tick a box or fit a mold or become this perfect ideal, because surgery shouldn't be to look like a different person, but to feel more like you. It has to be your choice and not to please or offend others. So my choice was partially taken away having multiple surgeries because of my chest collapsing so young, which meant that I became bigger than perhaps I would have naturally have chosen. But this has then led to judgment from people. To see that my bust size is excessive, I think that is really what draws attention, and it's not something that I'm seeking. But that was not my intention, to have an oversized bust. It just happened gradually with time with each repair surgery that I had. And for this reason, you can get stares. It's something to consider that if you do have an abnormally sized bust, whether it's natural or you've had surgery to enhance yourself, this will draw attention from people, whether you want that or not. Even if you are covered up, this mass is still there that people are aware of. Simple things like going to the beach, going to the supermarket, going to the school run, you do get stared at. People notice. Because it's unusual, it's out of the everyday ordinary routine to see someone who is slim with a very large bust, and people make judgments based on that. Because of this, I have seen couples argue where a partner would look towards me, where a man would glance at me and his partner would be really upset, and they've had a full-blown argument in front of me when I don't know them and I've never spoken to them. When I'm at the school gates in the summer, even now it's boiling hot, I'm melting, I feel inappropriate dressed in a vest top, whereas covering up in hot jumpers or jackets and coats just isn't possible at this time of year. I would literally pass out from the heat. So just to understand the everyday things, how will that affect you after you've had surgery? I am naturally a fan of a fuller bust. I think being a tall woman, it is in balance with my body, but these are excessive. And for that reason, I'm really looking forward to having a breast reduction surgery. Also, the health benefits that will bring for me, to be able to wear clothes that fit me without having to be a dress size up and baggy elsewhere. At the moment, I am a size UK 8 and normally can squeeze into the top half. The bottom half fits me fine. Sometimes I have to size up to a size 10 on top, but it really depends on the brand that I use. Likewise for underwear, swimwear, gym wear, I normally have to have it custom made, or a one size fits all that's adjustable with side ties or multiple hooks to be able to take it in. But even then, it always looks like I'm bursting out of something. It looks inappropriate. And in my 30s, now that I'm 36, that's not something that I feel I can do for the rest of my life at this age. I've had my 20s, I've loved living my life, and now as I look towards my 40s, I really do want to have a more understated appearance. So being able to fit into more gym wear is amazing. To be able to walk into any shop and be able to buy a bra already made is amazing, rather than squeezing into sizes too small. To be able to just feel that I'm not judged for being me, to be able to walk down the street like everyone else, wear the same fashion as everyone else, and not look out of place, I think will be really, really incredible. Whether you decide to have a large bust, a small bust, a natural bust, or an enhanced bust, it is entirely up to you. And I hope that you can see this video diary is without judgment or criticism at all. Everything that has happened in my life is for a reason, and it's brought me to where I am today and the person that I am today. And I'm incredibly thankful for that. So I hope to show you the flip side of the coin, that you can make choices to downsize with your breast surgery. People don't always just have to have surgery to get a larger bust. You can have a reduction and an uplift. So I'm keeping a blog on my surgery journey, as always, at www.tracykiss.com. I hope that you will join me there. I hope that you will ask lots of questions, give me your thoughts and feedback, and together we can go through this experience. I will show you the ins and outs of everything involved. I am flying to Istanbul in Turkey in just a few days' time to have my surgery. This is because of the exceptional aftercare and skill of the surgeons and their teams. It's really important to me to not just look for the cheapest deal or the most affordable, but to go to specialists, people who have done thousands of surgeries, who specialize in the results that you hope to achieve yourself. The problem that I have had with surgery in the UK, I've had 3 of my breast surgeries in the UK, and they are the ones that have ruptured and also put me in danger with precancerous cells. So it's really important to know that actually going abroad doesn't have to be this scary thing. And being in the UK doesn't give you any guarantees of exceptional care. What we need to do is our research into the surgeon that you hope to use. Have consultations, ask lots of questions, and ask to see before and after pictures from their previous clients and patients. Look online for any complaints or feedback that is less than desirable, and ask yourself why. A major part of having surgery is down to the aftercare and your good health in general, making sure that you are as fit and healthy as possible to not only deal with anesthesia, but also to sail through your recovery. For me personally, I find this involves being healthy and active, drinking lots of water, making sure I am taking vitamins and keeping my body as strong as possible. This means that after I've had my surgery, I can get up out of bed, I can move around, have my circulation going, and get off of pain relief as quickly as possible so that I can feel more like me again. I will show you everything involved in this surgery, from leaving my home in England to landing in Istanbul, and everything and anything in between until I touch down and come back home. I will aim to run this diary for 10 weeks, which means that I can return to the gym after 6 weeks and then have 30 days to get myself into post-surgery condition, to hopefully end up in a very fit and active and healthy condition after having taken time off of the gym and recovered fully from having my surgery. So please come along and enjoy in this journey with me. I hope to break down some taboos talking about breast reductions and uplifts, and also show you that no matter what size you are, beauty comes from within. We are very fortunate in this day and age to have the freedom of choice over our appearance. Whether you have an aesthetic or surgical enhancement, it is totally up to you how you feel at any age and stage of life. Self-love and self-care is not selfish. Ultimately, we should allow people to express themselves in any way that they see fit, whilst being safe and careful.